Mental health employees picketing Kaiser say access alone is a challenge due to high demand and low staffing numbers. And when patients finally reach out,
which is a very vulnerable thing to do. I'm not okay. I finally need to talk to someone. So first contact is through our call center on the phone. They may wait on hold, just trying to talk to a human being for so many hours that they give up, or that they leave a message which is not returned for weeks.
And when they finally get a real person on the line,
the second visit takes just as long after. That is definitely not the way I was trained to provide services.
And then once I have an appointment, I'm told I have to wait 2 to 3 months for them to actually have an initial appointment. You know, my family member needs help now.
It's with that urgency, and while asking for comparable union wages with other Kaiser employees, that 51 healthcare workers went on strike for 3 days to get Kaiser's attention on Oahu and the Big Island, and seen here on Maui, where Dr. Rachel Kaya says Kaiser's attitude has been,
you need to stack more patients into every one of your working days, and if you don't like it, you can leave. I don't understand how anybody would think that it's reasonable to attract the staff we need under those circumstances.
Dr. Kaya says on Maui there are 10 psychotherapists and 3 additional staff for 62,000 Kaiser members. That staffing hasn't increased with the pandemic.
The pandemic has been particularly hard on, I would say, two particular groups, children, keiki, and kupuna. Even though they're at home, they're very, very anxious and scared, and, that's driving up the need.
Kaiser could not be reached for comment, but the hospital maintains that both its psychologists and clinical social workers make more than the market average. In Honolulu, Jeremy Lee, KITV4 Island News.